Tomorrow, South Africa joins a growing list of nations administering COVID-19 vaccines to children aged 12 to 17 years. So last week, the Department of Health announcing that this age group will be able to get inoculated even without parental consent. So for those parents preparing their children for vaccination day, what should they know? For more on that discussion, we're joined now by Wits University's Professor of Pediatrics and Child Health. That's Haroon Saloojee. Prof, it's great to have you with us this morning on the program. So, you can read it in two ways, I suppose. There are parents who will be excited that this has opened up for ages 12 to 17. And then there are parents who perhaps are a little approaching this with a little more trepidation. They've perhaps not even been vaccinated themselves. Give us your take on this decision by the Health Department.
So morning, Michelle. I think the Health Department has made the right decision.
Yeah.
For a long time, we've said that our priority is older people, particularly people over the age of 60, and that children weren't a priority, and that remains true. But South Africa has secured enough vaccines now to reach both adults and children. And also, it's time that we allow children to start living their lives as well. We've allowed with the vaccines a little more free movement for adults. And so children now need to be able to go to school, knowing that they may not pick up the infection, but also to start to socialize. I think the Health Department has made the right decision to now extend the program to children.
So, Prof, for the parents who are quite vexed by what the Health Department had to say when they made this announcement last Friday, that children aged 12 to 17, and this is according to the Children's Act, they can make their own decisions insofar as healthcare procedures are concerned generally. I mean, is this something that we should be a bit fearful of? Should parents have more of a say here? We're leaving quite a big decision up to our children?
So the ability for children to give consent to procedures, medical procedures, is not new. The Children's Act actually came through in 2005. And so children have various rights. They have a right to decide on medical treatment, whether to take it or not, whether they, for example, diabetic or asthmatic. They have a right over their sexual and reproductive health. So if children want contraceptives, they can take it. They can have an HIV test. So this is not new. It's been around. And it's something that we as pediatricians and child health advocates are welcome, because children over the age of 12 have a right to their bodily integrity. They have a right to decide what's right and wrong for them. Of course, we would like parents to always be in sync with children and children to inform parents of their decision. But the fact is that if children over the age of 12 decide that they want a treatment and their parents disagree, they have a right. And alternative, the other way around. The parents may want the child to have a vaccine and the child doesn't want it. That's appropriate. So this is a global phenomenon, but South Africa, we've had this for a while. And I don't think it's something parents should be too concerned about, because this is a right that's been around for a while, and children haven't abused this right.
Yeah, certainly. The other issue that was tabled last week in that briefing by the Health Minister and his team was the issue around the decision to give children a single dose of the Pfizer vaccine. Some concerns around the second dose causing incidents of myocarditis. Prof, can you just explain to us what that means?
Okay, so what myocarditis is an inflammation of the heart muscle. And usually what causes this is an infection, a viral infection, often influenza or COVID can give you a myocarditis. In more than half the cases, we don't know what causes it. So what's been found is that in American children, that particularly in boys more than girls, and particularly after being given the second dose, they've identified that children who have had the COVID vaccine have also had this myocarditis, or inflammation of the heart muscles. But it's a very rare condition. So in boys, in over 1 million doses, probably about 70 boys, and even less frequent in girls, about 9 in 1 million doses. But it's obviously something that it's not necessarily caused by the COVID vaccine. It's something that's associated with it. It may or may not be the result of it. But just to also make the point that COVID itself causes this myocarditis, and it's about 37 times more likely you get COVID than getting it through the vaccine. Nevertheless, because we're giving it to well children, we don't want them to have it. If you do get this myocarditis, in fact, 95% of children recover on their own, A few children have had to be hospitalized, but usually it's a mild illness, and within a few days with some medication, the children are well. So no child has died of the myocarditis. So the critical decision here is, should then, because it's more common with the second dose, should we withhold the second dose? Should we give children only the first dose? And in the United States, children have all received 2 doses, but in many European countries, including the United Kingdom, they've gone with this 1-dose approach, really to try and get more data about this, how serious is this risk. But as I've just explained, it's a rare event, and it certainly is not something that a reason to withhold vaccination from young adolescents.
Yeah, and as you say, there's a higher risk if indeed these children do contract COVID itself, a higher risk than what comes with the vaccine. So I'm looking at a whole range of other countries who have also approved a vaccine for children in this age cohort, 12 to 15, some countries 12 to 17, some countries as well. In the US, I understand there is an application for emergency use of a COVID-19 vaccine for children 5 to 11 years, Prof. I think we're still a long way off, just given the number of people who are yet to receive a vaccine in our country and perhaps even on the continent. But what are your thoughts on this?
So clearly the whole point of COVID vaccination is we want to give the people at highest risk those, and we know that's people over the age of 60, maybe people over the age of 50. It's good that we've been able to extend it to adolescents, 12 to 17, because their risk currently is almost the same as young adults. But we know that children 5 to 11 are the lowest risk in terms of serious disease. And so in the United States, the studies have been done, the dossier has been submitted to the Federal Drug Agency to approve it. I certainly don't see it as a priority for us. I think we've got other priorities in South Africa in terms of vaccination. We have to get health workers to get the second dose, and we really have to get our over 60s coverage higher. So that's something that will happen, but certainly it's not a priority for us.
Yeah, absolutely. Professor Haroon Saloojee, thanks very much indeed for your analysis and your perspective this morning. Some important context there as we prepare for the age group 12 to 17 to get vaccinated from tomorrow. Thanks very much indeed.